Welcome to the Empowered Endings podcast, where you will learn how to navigate the complexities of palliative and end-of-life care in new ways. Your hosts, Dr. Bob and Elizabeth Uslander, have decades of experience raising the bar in palliative care and family support. Join us as we explore the wonders and realities of palliative care, share powerful stories, introduce you to amazing people that we've cared for, and empower you to navigate life's final stages with more grace, dignity, and ease. Together, let's discover empowered end-of-life experiences. In this episode, we're excited to share the importance of having conversations to avoid crises and how vital that is to ensuring empowered end-of-life experiences.
So there's this this angst I feel like we have as a society around death and dying, and it's known. Most people are aware that it's not a guarantee that somebody who's in their final stage of life is going to get the care and support that they deserve and that would allow them and their loved ones to have a gentle, soft landing where people aren't traumatized and left with scars and guilt and regrets.
Yeah.
So an important part of what we're here to do is to help make sure that everybody has the ability to have an empowered end-of-life experience.
So you talked about having a footprint. And I think one of the things that's really interesting about everything that we are envisioning is it's a slightly, one could say, grandiose vision. We want to change the world in a big way. And we realize that we can only do what we can do in our little corner of the world. But we have a really strong idea, I think, of ways that we can make a substantial impact on a lot of people's lives that could really create a ripple effect for our society. And it starts with, as you said, it's the final stages of life. It starts with everything as far upstream as possible, people being willing to think and talk about the reality of our mortality. The only thing that we all share in life, right, is that we live and die. And to be able to come comfortably into relationship with that is a great starting point. Even if we don't do that, to be able to recognize at some point in middle or later years of life that we really need to understand who we are and what we want. What are our goals for quality of life, healthcare? How do we want our family to be involved or not? Who should be responsible at the time that we're in need of that level of support? And those are things that I think people don't think about, sometimes because it's hard to, sometimes because they don't know that they need to until they get to a crisis point where something changes. They're not able to manage everything on their own. They need their family to step in and support them, or they need their friends to step in and support them. And they haven't had those conversations. And so it becomes kind of chaotic, and it becomes more of a crisis because the conversation wasn't had at a time when everybody could ask all the questions that might come up and, dig a little bit deeper to understand what's behind these decisions and really get a sense and understanding of how and why someone wants whatever it is that they want in their journey. So this notion of conversations, not crises, catching people upstream to explore who they are and what they want out of life, I think it's a bit novel that would have an impact on how they experience death. And I think that the ability to connect with people who are ready to have those conversations has informed us that there are so many people out there who are really interested, actually, in understanding what they need to know, what they need to do to make sure that their final stages of life go the way they want them to. Everybody knows, that they might have some sort of medical event and suddenly be gone, but everybody also knows that it's much more likely that they'll have some constellation of conditions that change their quality of life over time, and who knows what they will be and who knows how that will impact them, and who really knows how to put in place what they would want and need to make sure that it's a gentle, dignified journey, and that everyone is empowered, not just the person going through it. But I think this is the thing that's so lost, especially in the system, in our society, and the conversations about it. The loved ones supporting. There is nowhere in the system that supports those who are supporting people through their journey. There's nothing in insurance. There's nothing in education. There's nothing in the healthcare system. There are with palliative care and hospice care teams, there are interdisciplinary teams where social workers are involved and typically have some conversation with the family, but there's no ongoing companionship. There's no one you can call in the middle of the night when questions come up. There's no real, robust personal connection with people who know and understand your values, your loved one's values, and what the wishes that everybody wants to help support actually are. And so the grandiose vision really is that everybody gets empowered in this journey, not just the patients who get to talk about things, have the right doctor there by their side, understanding their goals and wishes and guiding them, providing the right resources, overseeing the care, being personally engaged, all of which is powerful. But also the family members have their own personal guides and counselors, resourcing them, supporting them, walking with them through it. And as you mentioned, the healthcare providers, the collaborating providers who want to know what's going on when they're not able to be involved because of the limitations of the insurance model, who want to be able to provide resources but may not know where else to find them because they only have what's available to them through their healthcare organization, institution, who want to learn more about what the options are for the patients and families that they're supporting, but their organization doesn't have that education, that continuing education available to them because they don't agree with it or they don't have the resources for it. So the idea that we can impact not just each little life at a time, but whole communities, whole family systems, generations of people by providing this connective, supportive care seems like a really simple buy-in. Like it should be it seems like everyone would say, yeah, of course. Why are we not all doing this? This is how it should be done. But it is sometimes hard to get people to talk about it. There are, as you and I both know, there are people who are chomping at the bit to have these conversations. And then there are people who are very uncomfortable with it. And the idea of having a conversation in and of itself is really challenging.
Yeah, it's beautiful. And there's a lot of people who it seems like they feel like talking about death will make it happen sooner. That it's if they don't address it, if they're not giving it any energy or thoughts, that it will just sort of not find them, not notice them. And we know that doesn't happen. And I think part of what our goal is through all of the conversations, through all of our educational opportunities, through all of the relationships in this podcast is to talk about these things in a way that's comfortable, talk about them even in a way that can be humorous we're not, of course, we're trying not to be disrespectful or ignoring the sensitive nature of these topics, but it's part of life. It just is. And ignoring that is at your own peril, right? And because the key to being able to have an empowered ending is to open yourself up to being educated, to understanding how to advocate for yourself and your loved ones, and to prepare and to prepare yourself and to prepare the people who might be called upon to make decisions on your behalf. And as I've been talking with people and doing advanced care planning sessions and helping them, understand all these nuances and put a advanced healthcare directive in place and identify who their healthcare agent is. The last person I went through this process with said it very eloquently, and I can't remember exactly what was said, but he felt so at peace because he was empowering his family to have a roadmap if he couldn't guide them on himself, if he wasn't able to communicate and tell them what to do, if he lost his ability to make decisions and to communicate, that he had this, he felt he was giving them a gift by making sure that they didn't have to try to figure it out when it was all unfolding, and just being able to have these conversations with them, ensure that they're comfortable with his wishes, and then putting it aside and knowing that if something happened, if he had a fall, a head injury, if he had a stroke, if he had an overwhelming, infection that rendered him incapable of communicating, they know what to do. They have the map to get him to his final destination in the way that he would want.
I think one of the things that occurs to me too is how important resources are. And you mentioned earlier our foundation, and of course, this is something that is very exciting and inspiring to me, because one of the things that I think is such a challenge in our society today is how it really does require having resources to get what you need, because the system doesn't provide it. And however one feels about that, that's just part of the reality. So creating a foundation so that financial burden is never an obstacle to people receiving the care and connection and support that they need and deserve is something that I think helps to fill the other gaps. A lot of what we talk about is filling the gaps in the healthcare system, but there are major social gaps that we're also talking about. The lack of family support is not part, family support is not part of the medical system, but it is also a major social gap, especially now with the sandwich generation of care providers, right? So you've got people who are grown up, adult children of people who are aging, who also have their own children, and they are responsible for kind of keeping the whole family afloat, which is an enormous responsibility. And there's nothing in the system to help provide for that. So people are having to choose between their careers, their, caring for their own children and caring for their parents in these really crucial times in life. And it really shouldn't be that kind of a choice. We should be able to resource people adequately so that they can live a healthy, wholesome life, no matter where they are in that particular intergenerational spectrum, and ensure that people who want to stay home can stay home because they can get care in home rather than having to go to a facility where they perhaps would not want to go on living without their loved ones in an unfamiliar environment, or that, those adult children who are having to care for an older loved one can continue to work and support their family member without burning out because they are, working a full-time job to support their family and also providing care the rest of the time that they have, what would otherwise be free time that no longer exists. And then their well-being is at risk too. And there is data that speaks to, for example, with bereavement care, there's data that demonstrates that really good bereavement support is a preventative health care measure. So bereavement support has actually been included into the insurance model in Canada because it's very clear, the data shows that good bereavement support supports positive health outcomes later on. And so it's reducing the impact on the healthcare system in the future by giving adequate support to someone who's going through this particular kind of challenge. And I think we don't study enough of this. Maybe I'll get a PhD one day and be able to speak to it with a lot of science behind it. But the reality is so obvious. If we provide connection and care every step of the way through a person's life from early childhood on, the outcomes are, broadly speaking, better for everyone. It's a very simple concept. And it seems like it should not be hard to grasp and integrate, but evidently it is. So we have this foundation trying to fill that gap too.
I think this would be a great opportunity to share what is empowered endings. What is, we know we've talked about what an empowered ending is, and we'll dive deeper into that over the upcoming episodes. But what is the Empowered Endings Collective, so that people just clearly understand what it is and what we are doing through each of our organizations and entities?
Well, we have a medical practice, which you alluded to, started in 2016, providing geriatric, palliative, and end-of-life care, as well as grief and bereavement support and holistic therapies. So the medical practice offers in-home care for people dealing with complex and terminal illness. It helps people get from hospitals or other living facilities back to their home so that they can be in the comfort of their own home and getting the care that they need and the support for their family. It focuses a lot on options, giving people all of the options. What level of care would they like to have? How would they like to move forward? What thresholds do they have for stopping certain kinds of care and treatment? And how do we support them in exploring those things and then helping their family understand the decisions that they've made? So having an engaged physician, really constant, connected, personalized care from the whole collective. We've, as you know, doctor and doula partnership is something that we've spent a lot of time working through and on, and building relationships with end-of-life doulas, palliative care doulas, grief doulas, people who specialize in a particular area of care and can serve as a companion and guide to the patients and families, providing education, spiritual and emotional support, all kinds of practical support as well. Giving people access to end-of-life options, which are legal in California, which is where we are practicing. Giving people access to holistic therapies, which we know also have a profound positive impact. I mean, the data, again, I love data, huge nerd. The data alone on the power of music in quality of life and actually even improving like the capacity of a body to move in a way that is comfortable and not constrained, for example, with Parkinson's. It's incredible. So bringing those holistic therapies and integrating that into the care in home, ensuring that the collaborating providers are connected and informed so people don't have to give up their other doctors, their primary care docs or their specialists. They stay in touch with whatever relationships they want to have. And I think all of those things are the outcome of the good planning, the robust end-of-life planning, people really identifying what they want, how involved they want their team to be, what kind of team they want to have, where they want to be when they're needing that care and support, and then what kinds of options they want to explore and who do they want to be a part of that journey with them. So that's the medical practice. Go ahead.
Well, I just wanted to, for the medical practice, I wanted to make sure that it's clear who we take care of, what we do, what we are, what we're not, right? We're not a hospice agency. We're not a clinic. We see people in their homes. We meet them where they're at. We provide care and support that is consistent with what their needs are and what our capacities are. We wrap around the care that's available to them through the traditional healthcare system. And we don't work with insurance or bill insurance or Medicare. We have a direct relationship and contract with the patients and families. So they're able to, we partner with them in determining the value that they're receiving from us. And we also work on a sliding scale so that people who can't afford the standard fees are still able to get care and support. We often bridge people from dealing with their complex illnesses where they're getting a more aggressive care and hoping for cure. And when that no longer is available, feasible, desirable, we help to bridge them to a more comfort-focused journey, and sometimes bring in hospice, sometimes bring in other resources. So we meet people where they are. We provide the care and support and counseling and guidance to the loved ones, and just help them have this really holistic, supported, gentle approach to the final stage of life. That's the medical practice.
Yeah. And after a number of years, we realized that we had gotten such an extraordinary amount of positive feedback from people telling us what a transformational experience they had under our care, that we thought, maybe we can give more people access to more of this. And so we started building our management services organization, building out our model as a system and creating the necessary materials to train and mentor other physicians in other communities who are interested in creating palliative care and family support practices where they are, using all of our experience as a guide to help them establish themselves without reinventing the wheel. And then, of course, having our management and marketing support over time. So we are now poised to support other physicians in communities throughout the United States and building their own practices. And I think what's interesting about that is so many people have come to us saying, is there anyone else that does what you do? I want to do this too. How do we do this? There are so many people throughout the US, doctors in particular, who really understand that the system has shortcomings, and that they would really love to be able to provide higher level of care and quality of care to their patients and their families, and to make sure that people have that sense of safety and connection throughout the journey, which is amazing that there are so many other people who are interested in doing this too. It's very exciting.
Yeah, it's very exciting to be in the position shortly of being able to help expand the model and expand the access to the kind of care that people are in need of. And then we started doing education. We realized that there's so much information that is that people need to have access to, and there's so much lack of awareness of so much of what is happening and what's possible, that we started doing webinars and presentations and building this online community, which has been beautiful. And you've been such an incredible force, and our team has really gotten behind this. So in a resource library that has resources for so many people who are trying to navigate this journey, and all of that's been created for the past several years is now to be, through your wisdom, through your heart, through your generosity, is all being donated into the foundation, so that everything that we offer, all of our education, all of the community building and resources, will be free for people with no barriers to access. Yeah. And I'd love for you to share a bit more about the vision for the foundation.
Thank you. I'm so excited about that. So, I spent the last 4 years building out community resources and education because those are the things. I'm a social worker at heart, and those are the things that I think are the most important to help people empower themselves. Being connected with people who, are understanding and able to have these conversations, having access to resources, like a clearinghouse of resources on 13 different topics, from aging well to end of life options and everything in between. And the education. One of the things that I love about the work that we've been doing with this is amplifying the voices of all of the other wonderful people doing good work in the world. There are so many people, doctors, nurses, doulas, social workers, chaplains, people who just have profound personal experiences, people who are really passionate about the field, even if they don't have healthcare credentialing, who really understand the human dignity and the needs and what's missing in the system. And it's hard to find them because they're here and they're there and they're somewhere else. And so bringing all of those voices together and creating a platform for people to provide their message, their expertise, share their wisdom has been such a joy. And the people that we connect with are so extraordinary. And I can't wait to do more of it. We were doing all of that under the notion that it was a business that, we were going to charge for the education and recoup the cost of development and things like that. And it just doesn't sit right with me to have any barriers to access to the thing that I think is the most important thing that people need. I think having access to community resources and information that allow people to understand whatever it is that they are exploring should be a fundamental right. And I look around at a lot of the nonprofit work that's being done in our field and the for-profit work that's being done in our field. And there's a lot of really great stuff out there, but I kept hearing this message of, I want to be a doula, but I can't afford what it costs to do this certification. I want to support people in end-of-life planning, but I can't afford what it costs to get the platform and get that education. I want to understand more about what it means to be an end-of-life doula, but I can't afford whatever it is that the cost of the education would be. And when people, reaching out and asking, I'd really like to learn these things, but I'm just not in a position to pay for it. And something about that it just really is heartbreaking, actually. Like, it makes me really emotional. The idea that people want to grow and learn and can't because they don't have the resources. That's not the way the world should be. So very excited that we're moving all of our community resources and education over to the foundation completely, not just reducing barriers to access through, offering scholarships, but completely removing barriers to access so anyone can make use of anything that we have to offer. We have other really great free services. We have support groups. We have a legacy library, which is a library of stories told by people who have lost loved ones. And it's actually a process that I adapted from dignity therapy, which is an evidence-based process to support people who are in their end-of-life journeys. And I adapted it to the bereaved family members. It's no longer an evidence-based practice because it's my adaptation, but the idea is to create an opportunity for the bereaved family members to tell a story that honors their loved one and gives them a sense of empowerment in creating a legacy for that person's memory that can be shared with family and anywhere else, which is a really beautiful thing. We have financial assistance that we offer for things in particular that are hard to find resources for, like medical aid in dying. It's challenging still for people to find resources for medical aid in dying, attending physicians, consulting physicians, medication. And so even though in our practice, for example, we do offer specialized end-of-life option support and we offer it on a sliding scale, many of the other providers don't. And the medications are, through pharmacies, which again, they may offer on a sliding scale when our foundation pays for it, but they can't just give their services away for free. So being able to help bridge those gaps financially. And I think ultimately to have a place, empowered ending centers, where people can come to get the care, the counseling, the training, the education, the resources, the information, the community, and the connection that they need or want around palliative and end-of-life care. There are some great models for nonprofit hospice homes, which tend not to have thrived because they have to work within the constraints of the insurance model. I think that we can create something sustainable that serves as a clearinghouse for empowered endings so that people can be informed, connect with the people and the resources that they need, and have a safe place to go to explore their options and live them out if that's their wish.
Awesome. Beautiful. Thank you for so eloquently sharing all about the foundation. So we have the medical practice that does medical care, counseling, family support in San Diego and throughout Southern California, and hopefully before long, spreading throughout the country. We have the management service organization, which will help with that and help to create the absolute best, most efficient, most comprehensive and caring practices. And the foundation, which is devoted to education, raising awareness, and building on the capacities of people, both lay people and healthcare providers, and offering financial resources. So it's a beautiful collective that all with the same mission, improving end-of-life care for everybody. And we are here for the journey. We are on this beautiful ride together, and I'm thrilled about everything that has been, everything that we've experienced at this point, and what we're going to be engaging and participating and sharing in with beautiful partners, an amazing team, and we're hoping that people will continue tuning into our podcast so that we can continue sharing all of the beautiful developments, introduce you to some amazing experts in palliative and end-of-life care, and help share more of their wisdom and their experiences. We're going to introduce you to some of the loved ones of people we've cared for, so we can talk about some of the realities of navigating the healthcare system. I know people often come to us and say, I'd love to share more. I'd love to share our experience so that we can help other people avoid some of the traumas and the struggles that they went through, and also identify some of the ways to enhance and ensure that the journey can be more gentle and as you shared, potentially transformational. Because we are here to tell you that the journey of supporting a loved one through their end of life, the final chapters of life, can be transformational and healing for those who are left behind. And that's really what we're trying to do. We're trying to empower people to have that kind of journey, and to at the end of it, when their loved one is gone, to be able to feel confident that they did everything they could. They gave them every opportunity to experience the most peace and dignity through their final days. And if you lose a loved one, you're going to grieve, you're going to miss them. But if you can do all of that without the angst and the guilt and the regret and the remorse of not of allowing them to experience things that they didn't have to or shouldn't have had to. That's what we want to do. We want to help to give people the gift of a gentle, easy life, devoid of the guilt and regret that doesn't have to be there.
And I think that one of the things that's most important about how we're doing that is through the partnership with our team. I mean, you and I have been in partnership and for a while, it was the two of us finding a way, figuring it out. We have an extraordinary team, and there are so many wonderful people who align with these values, who understand how important it is to provide this kind of care and support, who don't want to be stuck in the healthcare system, spending the vast majority of their time documenting for insurance instead of being present with patients. And I think that part of this vision isn't just providing partnership, care, and support with patients and families, but it's also about building a business that really honors everyone who is a part of that process. Everyone who's a part of that process. You, as a physician, have a very King Arthur approach. The Knights of the Round Table, you are not focused on the hierarchy. In my experience, you are focused on the connection and the community and the partnership that we all come together to build. And I think that, I can't sign off without giving an extraordinary shout out to our team, because they make all of this possible. Everything that we are envisioning, we couldn't do without the amazing people that we have in our corner who are doing this work with us. So, I think that all of the patients and families who are part of our journey or whom we serve recognize and understand that too, because they are also constantly shouting out to these incredible team members providing this incredible care.
Thank you. Thank you for bringing that in. I absolutely echo that. Well, thanks for tuning into the Empowered Endings podcast. We look forward to next time, and we look forward to partnering with you in helping to raise the bar on palliative and end-of-life care.
Thank you for joining us today. We hope you found this episode to be valuable. Having tough conversations about how you want to experience the end of life is so important. And please share this podcast with someone you know who needs to hear it. We're all in this together. For more resources and support, please visit empoweredendings.com. Until next time, remember that every ending can and should be an empowered one.